Hello friends, myself Professor Sanjay Purohit. I would like to extend a warm welcome to you on my YouTube channel. I would like to thank everyone who has subscribed my channel and encourage you to do so. If you have not already subscribed it, please subscribe it so that you will get a new video notification earliest. Friends, today we are going to talk about Stringhalt in horses. In the clinical posture series, this is my fifth lecture. Stringhalt is also known as equine reflex hypertonia. This is the neuromuscular condition. Stringhalt is motor disorder. Stringhalt is caused by trauma and degeneration of sciatic and or peroneal nerves. There is generalized distal axonopathy. There is spinal cord lesions. Stringhalt involved the lateral digital extensor muscle tendon unit. There is gait abnormality in Stringhalt. There is involuntary exaggerated upward flexion of one or both the hind limbs that occurs at every stride at walk. This looks like a jerk or hop. The dorsal surface of the fetlock joint may actually hit the abdominal wall in severe cases, like this. Disorder may be unilateral or bilateral and can vary in severity from slight exaggeration of normal movement to motion wherein rear foot side the belly. The limbs may remain flexed for several minutes. When both pelvic limbs are severely involved, the forward movement is only possible by bizarre, that is bunny hopping action, like this. Degree of hyperflexion may vary from mild to severe. The clinical sign most noticeable just after the rest, after the turning sharply, braking, going down a slope, during gait transition, during cold weather. Technically considered as unsound. Technically, Stringhalt is considered as unsound. Stringhalt is not a reaction to pain. So the affected horse are not necessarily uncomfortable. Stringhalt generally occurs stride at walk but can lessen at trot and usually absent at the canter. Now we discuss about classification of Stringhalt. Stringhalt is divided into two categories or two types. First one is acquired Stringhalt. Acquired Stringhalt is also known as Australian Stringhalt, plant associated Stringhalt, pasture associated Stringhalt, or sporadic Stringhalt. Second one is idiopathic Stringhalt, that is also known as true Stringhalt, classic Stringhalt, or atypical Stringhalt. Now we discuss about etiology and clinical sign in cases of the Stringhalt. First we discuss about acquired Stringhalt. Acquired Stringhalt, Australian Stringhalt, plant associated Stringhalt, pasture associated Stringhalt, or sporadic Stringhalt. These are the names of the acquired Stringhalt. Stringhalt, acquired Stringhalt is caused by false dandelion, ingestion of the false dandelion. False dandelion, the scientific name is Hypocaris radiata. This is false dandelion, plant of the false dandelion that is known as Hypocaris radiata. This is also known as cat's ear, hairy cat's ear, or flatweed. The other plants responsible for acquired Stringhalts are sweet pea, Lathyrus species. Second one is dandelion, Taraxacum officinale, and Malva parviflora. This plant. These plants are also cause the Stringhalt in horses. Outbreak of the Stringhalt in horses that are on the pasture in the late summer or fall. This is usually temporary, usually bilateral. The clinical signs are caused by a peripheral neuropathy and neurogenic muscle atrophy of the long digital extensor, lateral digital extensor, and gastrocnemius muscles. The Stringhalt occurs worldwide. The affected nerve fibers are also present in the larynx. So, the affected horses may exhibit the abnormal vocalization due to the laryngeal paralysis. Now we discuss about idiopathic, that is true, classic or atypical Stringhalt. This is caused by the trauma to the back, neck, or leg region. This type of the Stringhalt arises suddenly. All degree of the hyperflexion are seen, from mild spasmodic lifting and grounding of the foot to the extreme cases in which the foot is drawn sharply until it touches to the belly and is then struck violently on the ground. In these cases, the concussive forces may cause secondary injury. One hind leg may be more severely affected than the other. Cold weather, hard exercise, anxiety, or excitement intensify the clinical sign. The peripheral neuropathy have been identified in the sciatic, peroneal, and tibial nerves. Now we discuss about the diagnosis. Diagnosis of the Stringhalt is based on the history and clinical sign. This is diagnosed based on electromyography. The presence of the toxic plant in the feed in case of the acquired Stringhalt. X-ray and ultrasound examinations may be required to rule out the injuries. The additional diagnostic tests for the muscle disease such as PSSM, polysaccharide storage myopathy, and infectious disease such as EPM, equine protozoal myeloencephalitis. Differential diagnosis of the Stringhalt. Stringhalt may be differentiated from fibrotic myopathy, intermittent upward fixation of patella, during false Stringhalt sometimes appears as result of temporary irritation to the lower pastern area or even a painful lesion in the foot. Treatment. There is no definitive treatments. Some horses may recover spontaneously. The two options are available to treat the Stringhalt. First is conservative therapy or conservative treatment. Second one is surgical. In the conservative therapy, we manage the patient on medicinally conservative or medicinal treatment. Trauma-induced Stringhalt may resolve with exercise therapy. Most horses recover spontaneously without treatment once they have been removed from the infested pasture. Recovery is presumed to occur by axonal regeneration that may take up to 18 months of the time. The average recovery time is reported to be 6 to 12 months, although some horses may improve much more quickly. Oral phenytoin 15 to 25 mg per kg once or twice daily, helpful in stabilization of the neuronal, peripheral nerves or skeletal muscles membrane, electrical activity or decrease anxiety. Normal ponies may inject 400 international unit and warm-blooded horses with Stringhalt may inject 700 international unit of botulinum toxin type A that is marketed by the trade name of Botox into the long digital extensor, lateral digital extensor and vastus lateralis muscles. We should tranquilize the horse using the espomazine and also give the nervine tonic that are also helpful in Stringhalt. Surgical treatment. Lateral digital extensor myotenectomy. Resolution of clinical sign after blocking the lateral extensor may be useful to determine whether the myotenectomy indicated. Anesthesia. General anesthesia under lateral recumbency with affected limb upper side, or we can use sedation plus local anesthesia under standing position. The local anesthesia injected into the muscles of the lateral digital extensor starting about 8 cm above the lateral malleolus of tibia. A second injection of the local anesthetic solution should be made over the tendon below the hook joint. before it joins the long distal extensor tendon site. Proximal incision should be 4 to 6 centimeter above the lateral malleolus of the tibia. The distal incision should be 4 to 6 centimeter below the joint. Aseptic preparation of the site, then incision is made on skin, subcutaneous tissues and fascia directly over the muscles of the lateral distal extensor 4 to 6 centimeter above the lateral malleolus of the tibia in vertical direction, parallel to the muscles fiber. Muscles belly and tendon of the lateral distal extensor muscles have been isolated using the blunt dissections and heavy curved instruments is placed underneath it. Now 2 centimeter long incision is then made over the distal portion of the tendon before it joins the tendon of the long extensor. Before severing the tendon, the surgeon should ensure that the tendon in distal incision corresponds to the muscles belly in the proximal incision by pulling it. Part of the muscles and adjacent tendon are removed between these two incisions by transecting the tendon at the distal incision and pulling it out through the proximal incision. Removing the tendon from its sheath is maneuver that requires substantial forces, particularly if adhesions are present. After the entire length of the tendon has been exteriorized, the muscles is severed by proximal aspects of the incision, thereby ensuring that at least 2 centimeters of the muscles is removed and incision is also closed. Improvement may not be evident until 2 to 3 weeks after the surgery, and not all cases respond. The proximal incision is closed by this manner. Heavy fascia and subcutaneous tissues could be closed in simple continuous pattern using absorbable suture materials. You may use catgut or vicryl. Skin is closed in simple interthread suture by using non-absorbable suture materials like silk or nylon. The distal incision is closed with skin suture only using non-absorbable suture materials in simple interthread pattern. Wounds are covered with sterile dressing and bandage for 10 to 14 days to control the seroma formation. Hose is confined to stall for this time, after which the suture can remove. Hose is then given 1 week of the controlled hand walking, and normal exercise can resume 3 to 4 weeks after the surgery. Complications. There may be dehiscence, there may be infections, there may failure of improvement of the lameness. Prognosis. Prognosis varies depending on number of factors. Horses may return to performance, but they can still have good quality of the life. Most horses with acquired Stringhalt improve within days, but recovery can take months or years. In some cases, relapse may occur, but even severely affected horses may return to normal. Idiopathic Stringhalt is usually irreversible without surgery. The acquired Stringhalt prognosis is fair, maybe spontaneous recovery, although a few have Stringhalt of such severity that they should be euthanized. Idiopathic Stringhalt, the prognosis is guarded to favorable because surgery is unpredictable and result in partial to complete recovery. Now we discuss about difference between upward flexion of patella and Stringhalt. Difference between upward flexion of patella and Stringhalt. Sign. In case of the upward flexion of patella, jerky movement and extension of hind limb. There is over extension followed by flexion. While in case of the Stringhalt, there is periodic jerky movement toward the over flexion followed by extension. Type of disease. Upward flexion of patella is musculoskeletal disease. Stringhalt is nervous disease or neuromuscular disease. Location. Upward flexion of patella at the stifle joint, but the Stringhalt is related with the lateral distal extensor muscles. Treatment. In case of the upward flexion of patella, we perform desmotomy, while in case of the Stringhalt, we perform tenectomy. Name of the operation: medial patellar desmotomy (MPD). It is also known as Bussey's method, are performed in case of the upward flexion of patella, while in case of the Stringhalt, we perform lateral distal extensor tenectomy, or known as peroneal tenectomy or Bocard's operation. Operative site. In case of the upward flexion of patella, the medial patellar desmotomy is performed on medial aspect of the stifle joint, while in case of the Stringhalt, the lateral distal extensor tenectomy is performed on lateral aspect of the box joint. This photograph showing upward flexion of patella. The limb is over extension, while in case of the Stringhalt, limb is over flexion, and anterior aspect of the fetlock joint is generally hit to the belly of the abdomen. Now quiz time. Based on today's lecture, we designed some questions for you. You are requested to solve them. At the end of this video, we provide answer of these questions so that you can check yourself. So, yes students, question number 1. Stringhalt, which type of condition is? Option A, neuromuscular. Option B, musculoskeletal. Option C, vascular. Option D, hormonal. Question number 2. Stringhalt in equine, also known as. Option A, medial patellar desmotomy. Option B, upward fixation of patella. Option C, equine reflex hypertonia. Option D, all above. Question number 3. What is the treatment for Stringhalt? Option A, Bocard's operation. Option B, Basie's operation. Option C, Bunnell's operation. Option D, Bolster's operation. Now question 4. During the Stringhalt, patella is locked on. Option A, lateral trochlea of femur. Option B, medial trochlea of femur. Option C, anterior tibial tuberosity. Option D, none of the above. Question number 5. Surgical treatment of Stringhalt is referred as peroneal tinectomy. Option B, Bocard's operation. Option C, lateral digital extensor tinectomy. Option D, all above. Now this is question time. Your request to check your answer. If you have any doubt, please see the video again and again and solve your doubts. Even after that, if you have any doubt, please write me. I will reply. Question number 1, option A. Question number 2, option C. Question number 3, option A. Question number 4, option D. Question number 5, option D. Thank you for watching this video. You are requested to like, comments, share and subscribe my YouTube channel Future Vets.